that is not immediately, is going to take a while. Think, use the brain, think. Until there is a pressure intense enough as to produce the shift of the mediastinum, and then the trachea is going to deviate. This is when tension pneumothorax happens, and this is the emergency of the pneumothorax. Okay, very good. And why this lady with breast cancer probably is not an emergency? The answer is very simple. You are very shy today, but the answer is cancer is not an emergency. Any cancer is an emergency. But don't forget that in oncology, the science that deals with cancer, there are three emergencies that you need to study. Hypercalcemia, the tumor lysis syndrome, and the superior vena cava compression syndrome. There are three emergencies in oncology that you need to know for Nclex, and the three emergencies have been tested. One, hypercalcemia. Why hypercalcemia? Because when a person has cancer, has metastasis in the bone, and the metastases are going to be hypercalcemia, and this hypercalcemia is going to clog, obstruct both kidneys, and the patients are going to have an acute renal failure. This hypercalcemia basically is treated flushing the kidneys with fluids and forcing the fluids to be expelled with loop diuretics. The other manifestation, I don't have the option here of having, okay, let me see if I can call a, yes. So because I believe in visual learning. Okay, so the other manifestation is called tumor lysis syndrome. Remember that tumors, cancer, are cells, malignant cells, but inside the cells you have a lot of potassium. You should know that. You have inside the cell a lot of phosphorus. Why do you have so much phosphorus inside the cell? Because inside the cell you have a lot of ATP. And you know what is ATP. Okay, but maybe you don't know that each molecule of ATP has 3 atoms of phosphorus, adenosine triphosphate. So a lot of phosphorus. And also inside the cell, you have a lot in the DNA of the nucleus. And in this adenosine that you see here, those are purines. And it should sound familiar to you. Purines produce uric. Somebody open the microphone. Okay, uric acid, yes? Okay, so the day of the chemotherapy destroys the cells. So now it's released to the blood the potassium, the phosphorus, and the purines. The purines transform in uric acid, and you know that the uric acid produces gout, but not only gout. Remember that the uric acid can clog the kidneys, producing also acute renal failure. The purines should be blocked before the day of the chemotherapy with allopurinol, the medication that prevents the transformation of the purines into uric acid, yes? And the phosphorus that is going to the blood produces hyperphosphatemia, high phosphorus. And you know that when the phosphorus is high, the calcium goes down. When the calcium goes down, you have spasms in the muscles, chevauché, trousseau, and you have seizures, and you have prolongation of the QT interval, which is the distance between the Q of the QRS and the T wave. This distance is prolonged when the calcium is low, and as a consequence, the patient will develop ventricular tachycardia, a ventricular tachycardia called the twisting of the point, which is in French pronounced torsade the point. Yes? So those are the consequences of the high phosphorus. And of course, you are knowledgeable of what happens when the potassium is too high. The heart is going to stop. Summarizing, the tumor lysis syndrome is a frequently tested problem in oncology, in which the day of the chemotherapy, many cells are going to be destroyed, releasing to the blood potassium. So you have hypercalemia. Phosphorus, you have hyperphosphatemia and hypocalcemia, and excess of uric acid with gout and clogged kidneys. So this is another emergency in oncology, a part of the hypercalcemia because metastasis. And the other one is something called superior vena cava syndrome. Superior vena cava syndrome. Superior vena cava, you know what it is a vein that comes to the right heart, right atrium, right ventricle. But this vein receives the veins that are coming from the upper extremities, the arms, and also the veins that are coming from the head, including the brain, face, and neck. All the blood that is coming from the brain, the head, the neck, and the arms need to come to the heart in this direction. If there is a tumor, a cancer growing here and compressing the vein, there is a moment that the blood flow through this vein, the superior vena cava, is impaired. And it's called superior vena cava compression syndrome. And it's seen mainly in lung. Remember that this is the heart. At each side of the heart, you have the lungs. So it is frequently seen in lung cancer, but also can be in other cancers that can grow in the mediastinum, like lymphoma. As a consequence, the blood is going to build up in the upper extremity, producing edema of the upper extremities and distension of the veins. It's going to build up in the jugular veins, producing distension of the external jugular veins, but the most serious, and edema in the neck and the face. But the most serious is going to impede the drainage of the blood coming from the brain. And as a consequence, the brain is going to be flooded by blood, and it's going to produce brain edema and increase intracranial pressure. Those are the three emergencies of oncology that you need to know that are frequently tested in Nclex. But only the finding of a cancer is not an emergency. Is not an emergency. The patient needs to go to biopsy, to studies, to CT scan, etc., and needs to wait. Yeah, so that's why these kind of questions are, sometimes difficult for some of you to understand, but thanks God that, you answer very well the question. The right answer of these questions is C, because cancer is not an emergency, and they are asking precisely the client that is not an emergency. It's a client that is non-urgent, okay? And of course, this person that is lethargic, and you know what is lethargic? This is serious altered mental status and has a hyperthermia. You need to be suspecting heat stroke, which is a very serious condition that kills babies left in the cars. If you are living here in America and you read the news, or you are, in contact with the universe, you need to know that. And also killed 17 old people in a nursing home in the last hurricane that we had here in Miami, the heat stroke. Okay, that's the question and the information that you can learn for your English of this question. Any question? Any doubt? Okay, we can move. Please know this oncological emergency, because the three of them are frequently tested in Nclex. In case you don't know that, you need to study that. Next question. A nurse is receiving a confused older client who is admitted with fluid volume deficit related to diarrhea and orthostatic hypotension. Okay, which appropriate intervention should the nurse implement to prevent injury? Okay, let me ask you a question, guys. Which injury you anticipate could occur in this client? Please answer me quickly without chat. Don't be shy. Fall, absolutely. Any person that has orthostatic hypotension, the immediate injury that should be prevented by a nurse is our falls. Absolutely. There are other injuries possible, but this is the number one. Once you understand the question, what do you think is the best answer? Asking the wife to stay all time with the patient while hospital. You cannot do that. You cannot delegate to the family members your work. This is unacceptable. Since now, I can tell you, this is unacceptable. Now could be other options. Apply lymph restraints. Encourage the client to drink 3 liters of fluids every 8 hours. Help the client sit on the recliners and attach a wandering alarm. What do you think is the best in nursing intervention there?
D like donut.
D like donut. Absolutely. This is the correct. There is no reason to restrain this client. There is not indication to restrain this client with limb restraints. Definitively, it is the most restrictive intervention, and is the last or known that we do. Obviously, drinking liquids will not prevent the fall. And if you give a person 3 liters every 8 hours, which is going to be 9 liters of fluids per day, just in case that you didn't read complete the option, you are overloading of fluid this person, especially considering there is an older person that probably has a weak heart, and it is malpractice. It is something incorrect. And drinking fluids, you don't prevent the fall. The way of preventing the fall is helping the client getting out of bed or moving. So when the client is going to stand, when the client is going to ambulate, you need to be at the patient's side with a gait belt, protecting the client, yes? And if it's possible, keeping the client in a recliner. And while you attach an alarm, so you cannot restrain the client, but you want something to warn you, to signal you that the patient is getting up. So you run to help the client and prevent the fall. This is the correct nursing intervention, the intervention that you will learn when you pass the Nclex and start working with clients. No question, yeah? Okay. A post-operative and still sedated client vomited. So notice that I'm helping you with highlighting. After turning, cleaning, and comforting the client, which action by the nurse is the most important to be carried out next? This is redundance to make you understand, okay? Request an order for IV fluids, auscultate lungs for adventitious sounds, assess bowel sound for and document the episode. I encourage the client to consume clear liquid. What do you think is the most important of these 4 interventions?
B.
Absolutely. B as in boy. the risk that this patient who was sedated when vomited is aspiration, and you don't know if the patient aspirated or not, but it's important to know it. So after you turn the client, after you clean the client, after you elevate the head of the bed, if the head of the bed was not elevated, to prevent further aspiration, you need to determine if the client aspirated or not. Because if the client didn't aspirate it, then you continue observation and prevent the aspiration. If the client already aspirated, then you need to contact the provider because treatment needs to be initiated. This is the rationale for that. So obviously, the priority here is after you do that, you auscultate the lungs for adventitious sounds. What are adventitious sounds? Abnormal lung sounds that are added to the vesicular sound, which is the normal.
Well, Virgin said,
You're gonna go to the Nclex and you may be gonna fail. You're gonna fail, and so you lose the 200. You lose the appointment, one opportunity, and you lose the time. You lose 1 month.
This is the reason attention deficit disorder for which my students, with all the effort that I do to explain to that, fails more than the class. They have the class fail my test. And they say because my tests are difficult. My tests are not difficult. My tests are much more easier than Nclex. The problem is that it's a culture that is wrong. Okay. So that's the reason for that. Okay. So this is a rationale for that. Please don't fail this kind of rationales because this is what Nclex is exploring to see if you are safe or not to give you the license. A patient on the medical unit is found to have rubella. What is the most appropriate precaution for the staff to take to prevent transmission of this disease? Infection control. So read the options. What is the infection control for rubella?
B.
Exactly.
Droplet
Rubella
precaution.
is droplet precaution. Remember the Spider-Man, which is very useful for droplets, okay? And don't confuse rubella with rubeola, because rubeola or measles is airborne precaution. The nurse is caring for an adult patient with burns on the front of the trunk, including the genitalia and the whole right upper extremities. Using the rule of nines, the nurse will document that the burn site is, I don't have here, okay? So if it is only the front of the trunk, those are 2 nines. If it is the whole right upper extremity, is 1 9. So I have 3 nines. 3 times 9 is 27. But I need to add 1 because the genitalia. So obviously the answer is 28. Okay, so know your rule of nines. Let me show you something. This is the rule of 9. No? This is the rule of 9. No? You know that the rule of 9 says this is the one. Okay, the one. Okay, this one. Let me prevent you from getting confused. Okay. Okay. So this is the rule of 9. This is the rule of 9. Okay, this is the rule of 9. And then you have, okay, the head, the arms are 1 9 each. And you can spread this 9 in front of back. So 4.5 in the front, 4.5 in the back. Yeah. And the trunk are 4 9s. So you can give 2 9s to the front, which is 18, and 2 9 for the back. And the other extremities, the lower extremities are 2 9 each. So 18 in total. So 9 in the front, 9 in the back, and genital 1%. And this is the most commonly used. Nevertheless, let me go back. Let me go back so I don't waste so small here. No, esto no es lo que yo quiero. Yo quiero aumentar esto. Sorry, a moment to see if I can't. No. No, no me deja. Okay, what I wanted to comment is share with you, recently, one student had a question that said the patient has a burn in the one arm, in the whole arm, burns in the whole arm and the neck. And the student told me that the only reasonable approximate value was 10%. And it was correct, because there are more precise or detailed assessment of the body surface area that are those that you have here, that are mainly used by the doctors, no? The doctors, this one and this one, the doctors, okay, to have a more precise, okay, evaluation of the body surface area that is burnt. So as you notice, they discriminate in the head, the neck from the head. So they give to the head, the proper head without the neck, they give 7. And to the neck, they give 1 in the front and 1 in the back. So if they have, okay, burned all the upper extremity, which is 9, plus the front of the neck, which is 1%, it is 10. Just in case you have something like this. I don't know if you know, I don't know if you know that in Nclex, you have 15 questions that are not evaluated. In those questions, in those non-evaluated questions, they can ask whatever they want, exploring whatever they want. And we never know exactly what they are exploring. I suspect that those kind of weird questions, where they go beyond the traditional in nursing, those are probably, I cannot be sure, but they are probably non-evaluated questions. A nurse checks emergency medication kept on hand for disaster threat of anthrax exposition to a community. The nurse determined that there is a sufficient amount of which drug. Which drug of these 4 you know are used in anthrax treatment and it need to be known?
B.
Ciprofloxacin. Okay, Cipro is the drug of choice in client with anthrax. Okay, so you need to know that has been tested, this antibiotic for anthrax, but also have been tested if the client is allergic to fluoroquinolones. Ciprofloxacin belongs to a family of antibiotics that is called quinolones or fluoroquinolones. Yes? Okay, if the client is allergic, which antibiotic have you heard that is used? No, nobody knows? Okay, the answer is tetracyclines. Tetracyclines, specifically doxycycline. This is another family of antibiotics, the tetracyclines, that are alternative to the fluoroquinolones in the treatment of anthrax. Guys, has been tested in Nclex. Please add this information to anthrax if you don't know it. Period. What kind of infection control is anthrax?
Standard.
Standard precaution. Any form of anthrax, inhalatory, pneumonia, skin, cutaneous anthrax, or gastrointestinal is a standard precaution. So it doesn't require mask, or it's only standard, okay? And you know the standard is the most important, okay? A nurse is caring for a hospitalized infant just diagnosed with RSV. On the basis of this finding, which of the following would be the appropriate nursing action? Initiate strict airborne precaution, wear surgical mask, gown, and gloves when caring for the child, leave the infant in the present room because bronchiolitis is not contagious, move the infant to an isolation room with another child with bronchiolitis. What is the best option there?
D.
D as in diamond, yes, because it is an infection that requires isolation. But we need to remember it is contact isolation. Even if it's a respiratory infection, the infection control is contact isolation. Because this virus is unique, has no different strains, they can be isolated but cohorted. So 2 cases of bronchiolitis. RSV and bronchiolitis is the same. RSV produces bronchiolitis, and bronchiolitis is produced by RSV. RSV infections and bronchiolitis are the same. So they need to be in isolation, in contact isolation, but can be cohorted. This is the rationale of this question. B as in boy is incorrect because in contact isolation, you don't need surgical mask, and it is very important. A nurse is caring for a client with diagnosed COPD. The nurse monitors the client for which acid-base imbalance that most likely occurs in clients with this condition. So we need to look for what? Acidosis or alkalosis?
Acidosis.
Acidosis. And of course, must be respiratory because the problem is in the lung. Remember that the cause of this respiratory acidosis is that they cannot breathe in and out with easiness. And for that reason, they retain carbon dioxide, CO2. And the CO2 is acid. So that's the reason for which, okay, they have acidosis. So which one is acidosis here? C and D. C and D are acidosis. But which one has increased CO2? C. So the answer must be C. Okay, C. Okay. If you use the acronym ROM to solve this problem, the arrow of the pH goes down, and the arrow of the CO2 goes up. So they are opposed. ROM, respiratory opposed, metabolic equal. So it can help you also. A middle-aged woman, this is the way that is tested acid-base balance in Nclex diseases, application to diseases. A middle-aged woman has been diagnosed with Meniere disease. Related with the pathophysiology of the disease, what modification the client's diet expects the nurse to be ordered? What do you expect doctors order in the diet of this client?
Sodium. A.
Reduction in sodium.
Reduction sodium.
Exactly, because Meniere disease is consequence of an abnormal build-up of fluids inside the inner ear. And which medication could help to eliminate this fluid? Diuretics, yes, diuretics. But for the symptomatic treatment of the vertigo that Meniere's disease produces, they use anti-vertigo medication like the meclizine, no? Meclizine, muy bien. A 7-year-old male client is admitted after passing out at the school. He has been experiencing intermittent episode of epistaxis. Epistaxis is nose bleeding, no? Along the last 2 days. What finding makes the nurse suspect that the client is experiencing posterior bleeding at the moment of evaluation? Remember, when there is a nose bleeding, the blood can come from the nostrils and are visible or can go back, and it's called posterior bleeding. So what makes you suspect of these 4 options there that the patient is having posterior bleeding?
B.
B as in boy, because the patient is swallowing, okay, frequently, because the blood is building up in the throat and need to swallow to prevent choking. Absolutely. Okay, so that's it. There is not any other option here that tells you that is a posterior bleeding, because okay, the others are independent. Very well. The nurse reviews the ophthalmologic evaluation of a 42-year-old client who shows a visual acuity of 20/30. What means these values? Okay, read the 4 options and tell me what you think is the correct answer.
B.
I agree. I agree. When you use the Snellen chart, you are going to have a fraction. Yes, a fraction has a numerator and a denominator. So this is in the top, the numerator. This is in the bottom, the denominator, yes? And the numerator, the one in the top, always is 20. The denominator can be 20 or higher. If it is 20, the denominator, so the patient has 20/20, it is normal vision. But as the denominator starts increasing, means that the vision of the client is not good. And the higher the denominator, okay, this number, the worst the vision. It is considered blindness when the client has 20/200, 20200, 20/200. This is the legal limit for blindness. The higher the denominator, the worse the vision. And the interpretation of this is that what the patient can see at 20 feet from the Snellen chart, because the client always is at 20 feet of distance of the Snellen chart in the wall, the normal vision person can see the same as the patient is seeing farther. I mean, at 30 feet in this case. So the client sees at 20 feet what a normal vision person sees at 30. Guys, all the questions that are in this page has been in Nclex. By the way, it was a test when I taught concept 2. Okay, one of the tests that I gave my student, because I gave this information in class, and all those questions are taking reproduction of Nclex questions. The nurse is evaluating a client with a long-term iron deficiency anemia, hemoglobin 9, and hematocrit 27, which finding is not expected to be seen in this client. Increased cardiac output, pica, bradycardia, and normal level B12. What do you think is the right answer of this question?
C.
Absolutely yes. Anemia produces tachycardia because the body must compensate the decreased capacity of transportation of oxygen. If you have many cars to go home tonight, if you work in the school, okay, you don't need to speed. If you want to take their car, in the case of the oxygen, you are the oxygen and the cars are the hemoglobin molecules, no? And they can go normally at normal speed home. But if there is only one car that need to take one, four of you or five of you and go to your homes and then come back to take the other, need to do as fast as possible. This is the way that I interpret why, to compensate when you have less transportation of oxygen than normal, you need to make the few transporters that you have move faster. And you know that the one that moves the blood with the hemoglobin is the heart. So the heart rate must increase. The responsible of increasing the heart rate is the brain, because brain, when there is anemia, receives less oxygen than normal and becomes upset. When brain becomes upset, is activating the sympathetic nervous system, and the sympathetic nervous system produces tachycardia. Cardiac output is the volume. What is volume? Milliliters. When you go to the supermarket to buy 1 gallon of milk, or you buy 1/4 of juice, it is volume. Yes, it's volume. Blood is measured in volume, specifically in milliliters. The cardiac output is the volume in milliliters of blood pumped, spit, move, push out by the heart in 1 minute. Of course, the heart contracts X times per minute. If you increase the heart rate, then the heart can pump, spit, move more blood. I mean, more cardiac output. So the cardiac output increases. It is correct, but you need to have tachycardia, no bradycardia. Okay? Pica is those cravings that develop people with iron deficient anemia. They start eating weird stuff. And B12 has nothing to do with the iron deficient anemia. So having normal level of B12 is not problem in iron deficient anemia. The one that is low is the iron. In all the anemias, you have tachycardia and increased cardiac output. The heart is working more than usual. Which of the following will the nurse identify as the priority nursing diagnosis during a client's vaso-occlusive sickle cell crisis? So you have a patient with sickle cell crisis that has a vaso-occlusive crisis. What is the priority here? Ineffective coping related to the presence of acute decreased cardiac output. You know that is not true. Pain related to tissue anoxia and hypokalemia related with hemolysis. What is the answer you said?
C.
C as in cat.
C.
Absolutely.
Pain.
This is the priority. But not pain because the pain. It's pain because the infarction. You need to understand that in the vaso-occlusive crisis, flesh, cells, tissues are becoming infarcted because the clumping of the red blood cells and the obstruction of the capillaries. So in this case, pain is translating the infarction of the tissue. So that's why in this case, pain is more than pain. Pain is infarction. It's the same as chest pain. Why the chest pain is a priority? It's not because the pain, it's because the infarction, you know? And that's the reason for which sometimes pain is not a priority and sometimes pain is, yes, a priority. When pain, like in chest pain and the pain in sickle cell disease, translate infarction, death of tissues, that's become priorities. Remember that we expect hypercalemia, not hypokalemia, due to hemolysis, because the potassium, the inside of the red blood cells are going to be spilled in the blood. We expect increased cardiac output, and we would have or not ineffective coping, but it is not a priority. It is a psychological need. A client with a history of asthma presents in the physician office with an acute asthma attack and difficulty breathing. While performing the assessment, the nurse becomes concerned that the client's respiratory status has worsened based on which of the following findings. What is the answer of this question? Because it's easy to read.
B. B. B.
Yes, decreased vesicular sounds and disappearance. Yes, B as in boy, of the wheezing. Another classical Nclex question. Again, guys, in this second page that is I'm using, it's all final test that I put to my concept 2 students. I have all questions taken from Nclex. Those are common questions taken from Nclex. Okay, so now you can evaluate yourself. How well are you for your Nclex? Because those are questions that appears in the screen the day that you sit. Not necessarily this, but this style of questions are the one that appears in the screen when you go there. And then you say, did I learn in my 4 semesters that I stayed in nursing school, or I need to study more because I didn't learn enough as to be able to answer those questions. So you need to make a self-diagnosis, and then you can wait a little more, or you say, no, I'm ready, I could go. So you are the only one that can make this diagnosis definitively. The nurse is admitting a client with suspected tuberculosis to the acute care unit. The nurse places the client in air precautions until a confirmed diagnosis of active TB can be made. It is correct. If you suspect TB, you need to place the client in isolation until the diagnosis is clarified, confirmed, or ruled out. Which of the following tests is a priority to confirm the diagnosis? Okay, chest X-ray, PPD, presence of hemoptysis, or the serum or the sputum positive for acid-fast bacilli, FB.
D. D.
D as in diamond, D as in David. This is the test that confirms tuberculosis. Neither PPD nor X-ray confirms tuberculosis. The confirmation of tuberculosis is the demonstration of the bacteria in the sputum. Okay, the presence of the bacteria in the sputum. Okay, and this is the test, acid-fast bacilli. Okay, you learned that in microbiology, no? Okay. The nurse is evaluating the respiratory system of a client who admits to smoke half a pack per day for the last 10 days and 1 pack per day for the 10 years prior to that. When evaluating the client risk of developing a respiratory disease, the nurse calculates that the client has a smoking history of how many packs over 20 years. This is something that you need to know how to calculate the amount of pack years that a person has smoked, because it's important when you do the assessment. The formula is number of packs smoked per day times the year that being smoked. So if the patient was smoking half a pack every day for 10 years, it is 0.5 or 1/2 times 10, which is 5. But then previous to that, he was smoking 1 pack times 10 years. So it's 1 times 10, 10. So in the first 10 years, 10. In the following 10 years, 5. 10 plus 5, 15. The patient has a history of 15 pack years. It's clear. It's very simple. Just number of packs per year times the year that have been smoking this amount. If they have different amounts, you need to combine both. No problem? We can move? Okay. A client with left-sided heart failure is progressing to pulmonary edema. The nurse assesses the clients and reports which of the following manifestation. Which of these 4 options are manifestation of pulmonary edema?
C.
B as in boy. Yes, bilateral crackles and pink frothy sputum. The first, dry cough, fever, chills, and dyspnea, it is suggestive of infection, pneumonia, or something similar, bronchitis. Crackles only in one lung is a problem in this lung. Pulmonary edema always is bilateral. So the crackle limited one lung is a problem in this lung. Need to be explored what is happening in this lung. And peripheral bleeding edema and flat neck veins are not characteristic of cardiac diseases. It's characteristic of a local problem of blood return. Because if there is distended neck vein, then you think in right heart failure, but this is flat neck veins. Okay. The nurse is performing a Weber tuning fork test. What technique is most appropriate? How you do Weber technique?
B.
Yes, in boy. You place the vibrating fork in the middle of the client's call. This is the way that is tested in English. Just asking you if you know how to do Weber in the client. A student nurse asks what essential hypertension is. What respond by the registered nurse is the best. What is essential hypertension?
C.
Exactly. Is a hypertension that has not a specific cause. The most common form of hypertension is essential or primary. It is something that occurs in a person without a definitive, specific, unique cause. Generally, it's multifactorial. There is a combination of many factors that could be present or not, are not constant. Could be a genetic predisposition, but not always. Could be aging, but not always. Could be obesity, but not always. Could be smoking, but not always. Could be a diet high in sodium, but not always. Okay, so there are combinations of risk factors that could be adding one to the other, producing the hypertension, but not one specific cause. Nevertheless, there is a form of hypertension called secondary hypertension. Very rare, It's less than 5% of hypertensive client. But then one specific cause of this hypertension can be identified. For example, if a person has Cushing disease, which is a hyperfunction of the adrenal glands, this person will develop hypertension because the Cushing disease. And if the Cushing disease is cured, is because can be cured with surgery, removing a tumor, producing too much cortisol, then the hypertension disappears. For example, if the patient has a pheochromocytoma, which is a tumor that overproduces adrenaline, epinephrine, then the same situation, etc., etc., etc. This is what we need to know. Your 72-year-old female has a history of cor pulmonale caused by a chronic lung disease. Which of the following symptoms are specifically related to right heart failure? Okay, so cor pulmonale means that the heart, specifically the right heart, has been damaged by the lung. This is the meaning of cor pulmonale. It's a right heart enlargements and failure as a consequence after many years suffering a chronic lung disease. This chronic lung disease could be cystic fibrosis that is inherited, or it could be pulmonary fibrosis, which can be idiopathic, or could be COPD that is more frequently related with smoking, etc., etc. But cor pulmonale is a chronic condition in which the right heart is damaged by the lungs problems. And they are asking you another topic, which finding suggests right heart failure. What is the answer?
Neck vein distension.
A is related with right heart failure. The other manifestation suggests left heart failure. Okay, the pink frothy sputum and nocturnal cough suggests pulmonary edema, left heart failure. Decreased urinary output, decreased left heart failure. Suggests left heart failure. If the left heart fails in sending blood to the kidneys, which happens in the left heart failure, then the kidneys produce less urine than normal. And dyspnea upon exertion. So when you exercise, it can be anything, but okay, it is cardiac origin, is left heart failure. Very well. Which of the following lab tests will the nurse check to help diagnose heart failure and provide insight about its severity and respond to treatment? What is the blood test that is elevated or is altered in heart failure?
B natriuretic peptide.
The BMP. The BMP, okay, B natriuretic peptide elevates in heart failure, and is the use of this test. All those have been questioned in English. A BMP less than 100, okay, rule out, eliminate the possibility of heart failure. This is the application of the BMP. Laboratory tests are performed to identify myocardial infarction. Which of the following blood tests is elevated in myocardial necrosis?
D.
Troponin.
B is in diamond, okay? Remember that the BMP is only the heart failure, is the D as in diamond, the troponin, okay? A 69-year-old male heavy smoker client reports several months with pain in the legs when walking to the mailbox. Okay, so old, heavy smoker, pain in the legs when walking. It suggests okay, something, okay? These symptoms are relieved when the patient stops walking and reappear each time he walks in a similar distance. So what is the name of this condition?
B.
A. Okay. The name of this condition is intermittent claudication. Intermittent claudication.
D.
Yes, in boy. Intermittent claudication. Okay, so it is ischemia in the muscle of the legs because atherosclerosis of the arteries of the lower extremities producing peripheral artery disease, peripheral arterial disease and has nothing to do with the veins. And it is a classical presentation of intermittent claudication. Which stage has this ulcer, skin ulcer, pressure ulcer that you see here? If you consider this fine line epidermis, this blue epidermis, this is subcutaneous, and this muscle is 1, 2, 3, or 4.
3. 3.
2.
3.
3. 3.
Okay. So notice that the ulcer is affecting the subcutaneous. Okay. When the subcutaneous is affected, it's a stage 3. Okay. When it is only a partial thickness, only the dermis is affected, is a stage 2. When there is no ulcer, there is no skin breakdown, is 1. So some of you need to review the staging of the pressure ulcer because are frequently tested. Okay? So again, stage 1, there is intact skin. There is no broken skin. There is not ulcer, but you have a non-blanching erythema. In this type of pressure ulcer, you need to place a transparent dressing to protect the skin, okay? And you intensify the changing position every half an hour, more frequent than before, yeah? And very careful with the incontinence. Stage 2, the skin is already broken. There is a hole, there is an ulcer, but the ulcer stops here in the blue, that is the dermis. So it is a partial is the opposite of total, yes? It's a partial skin thickness ulcer. It is going to be seen as a superficial excoriation or loss of skin, but still you see the skin in the bottom. You understand? It's a superficial crater, what you see there. Usually it starts like a blister, where the upper part, I mean the epidermis and the superficial part of the dermis is forming a roof, and there is a hematic, sanguineous liquid inside the blister, but easily is broken by the friction against the linen and the mattress. So you see the ulcer. Generally, what you see is the ulcer, the naked or the nude, okay, skin. And for those ulcer, you need to use a non-adherent dressing that provides moisture, like for example, hydrogel, and need to be covered, because this is not enough, need to be covered with a transparent dressing, a secondary dressing. When the ulcer is deeper and takes all the skin, and you see in the bottom the subcutaneous, the fat of the subcutaneous, this is a stage 3. Depending if it is dry or suppurative, it has secretion, then need to decide if you pack this with gauze or if you use alginate to absorb the fluids, if it is too moist, too macerated, or if it is too dry, which is very rare with this magnitude, then you use the hydrogel. And stage 4 is when the ulcer passes the subcutaneous and enriches the muscle. Can reach all part of the muscle or all the muscle, and you can see even the bone. But each time the muscle is seen, even if the bone is not yet seen, it is a stage 4. And don't forget that when you have a S-star, when you have an S-star there in in the surface, a scar that prevents you from seeing the button. You cannot stage the ulcer until this scar is removed, and it is documented as non-stageable. Please study that because it's good for the Nclex. The nurse is making an assessment of an obese adolescent and admitted with recurrent urinary infection. The nurse observed the following skin lesion in the patient's neck. It's a hyperpigmented, thick, velvety with groups lesion. You document this as
Metabolic syndrome.
you suspect a metabolic syndrome, and the indication is to do a metabolic blood work to see if the patient has glucose intolerance, yes, if the patient has hyperlipidemia, etc. Metabolic syndrome is frequently present or tested in Nclex. Metabolic syndrome is an epidemic, is a very important problem, and is that young people, children, adolescents, and young adults are too fat nowadays, yes? And they develop this metabolic syndrome. So they have obesity. This is one characteristic, but not any type of obesity. They have a prominent abdomen. They have a big barriga, a big belly. It makes a shape that is classically described like an apple. So a round trunk, very thick trunk, okay? And extremities, because they don't do too much exercise, that are thin. So it is an apple-shaped obesity. And the waist, you know what is waist? Where the umbilicus, where the belly button is, waist circumference is increased. All those details have been in Nclex as select all that apply questions. Then those patients tend to have in the skin of the neck, in the axilla, and between the legs, this hyperpigmentation and thickenings of the skin called acanthosis nigricans. Acanthosis nigricans. And then those people, when you check the blood pressure, is not normal. The blood pressure is a little high. It's not yet hypertension, so it's less than 140/90, but is higher than normal. Normal is 119/79. 119/79. 119/79. When you have 20/80 or more until 140/90, this is a blood pressure that is high, but not yet hypertension. They have this level of blood pressure. The blood pressure is going to be 130/80, for example. And then when you check the glucose, and the fasting glucose is normal. But if you administer a load of glucose and then you check the blood sugar after drinking a load of glucose, it is called glucose tolerance test, yes? Then the blood sugar will be high because they have pre-diabetes, type 2 diabetes, the one that is related with obesity, yeah? And then when you do the lipids of the blood that you know are cholesterol and triglycerides, no, the lipids of the blood, they have the lipids high, but in the triglycerides are high. But in the cholesterol, the most important is that the HDL, HDL cholesterol is low. This is the good cholesterol, is low, and it is a risk factor. Those clients will have a myocardial infarction in their 40s and a stroke in their 50s, very young, sadly. It's very sad, but it is a reality. It's frequently tested. Is tested as a other apply. Expect having a minimum of 75 questions. Of these 75 questions, that is the minimum that you can have in the Nclex, 15 are going to be non-evaluated. So you are going to be evaluated with 60 questions, yes? If you only make 75, yeah? And of these 60 questions, expect at least half to be select all that apply. Be ready for your Nclex. And it's an example of select of that apply question when you need to know several different details of a condition. Oral iron supplements are prescribed for a patient with iron deficiency anemia. The nurse instructs the patient to take the iron with which best food item. What you choose of the four?
D. D as in dog.
D.
Tomato juice, tomato juice, tomato juice. Orange flavored soda is flavored ED. Orange flavored soda is not
that
good.
is not orange juice.
Exactly. Okay. And the best the tomato juice is better than the orange juice, but orange soda is not orange juice. Yes. So an apple juice has no acidity. It's not rich in ascorbic acid, in vitamin C. The tomato juice has the highest concentration of ascorbic acid or vitamin C that favors the absorption of the iron. Remember that the juices don't have iron, but the vitamin C in some juices favor or facilitate the absorption of the iron that is given in tablets as supplements. Yes, and the orange juice, not the soda, okay, not the soda, and tomato juice are good example of them. Are we clear? So take care analyzing the questions. So read complete and take care and expand your knowledge. Doesn't need to be always orange juice. Is any liquid rich in vitamin C. Yes? Like orange juice or tomato juice or cranberry juice or strawberry juice, etc. Yes? The nurse received change of chief on the following 4 patients. Which patient should the nurse assess first? I have a 23-year-old patient with cystic fibrosis who has dry cough and difficulty to expectorate phlegms. A 46-year-old client with hip surgery who is complaining of sudden onset of shortness of breath. Hospitalized 77 client with fever and positive acid bacilli test in sputum, and hospitalized 35-old male with pneumonia and a temperature 102. It is an easy one. What is the answer?
B.
For ABCs, all the patients are, you know, in a predicament, but the one that has priority is B as in boy, because for ABC is the one that is presenting the priority. What disease you are suspecting in this client based in the sudden onset?
Pulmonary.
Pulmonary embolism. A 5-month-old infant diagnosed with Tetralogy of Fallot becomes upset, crying, and thrashing around when a blood specimen is obtained. The child's color becomes blue and the respiratory rate increases to 54. With the following action should the nurse do first? Initiate seizure precautions, assess for irregular heart rhythm, place the glass in Nietzsche's position, administer order oxygen. What you do first?
C.
C as in cat. C as in cat. Okay, and then you put the oxygen. But the first to do is to do the Nietzsche position. Those are the classical questions in Nclex. Guys, in Nclex, you have a number of questions that are basic and some questions that are very rare. Okay, it's very important that you don't fail the basic. Okay, because failing the basic like this, the one that is most be known, is when you are at the risk of failing the test. Okay, you could fail. You don't need to get 100 or 90 in Nclex to pass. Okay, you can have a lot of mistakes in Nclex and still you can pass. But it's important that those mistakes are not basic, are not, something that is common knowledge in nursing, okay? So maybe if they ask you about a very sophisticated, okay, a medication, okay, infliximab via of administration. What is the way of the via of administration of infliximab? Maybe you don't have any idea, and then you can fail this question. You will not fail the test for that reason. Okay, but if you, I don't know, if you don't give priority to respiration, if you don't give priority to risk for fall, etc., depending on the scenario, then you can fail the Nclex. Okay, so the basic are the important, very, very good. The nurse is caring for a client, the medical surgical unit, who suddenly becomes unresponsive and has no pulse. The cardiac monitor shows the following rhythm. Okay. After calling for assistance and a defibrillator, which actions should the nurse take next?
B.
Chest compression.
Initiate chest compression, because this patient, what is this rhythm?
Ventricular fibrillation.
It's a fibrillation. It's a fibrillation. And 100% of the client ventricular fibrillation don't have pulse and requires artificial pumping of the blood until being defibrillated. A client is connected to a continuous cardiac monitor, which begins to sound its alarm. A nurse sitting in a centralized telemetry desk sees a flat line and not electrocardiogram complexes on the screen. The first action the nurse after arriving to the client's room is to
A.
Or a systole.
Okay, the most important is to assess if the client is responsive and if the electrodes are in placement. Yeah, because this image could be a real asystole or a fake asystole. A real asystole will have the electrodes well placed and the patient will be unresponsive. If it is a fake asystole, one or more electrodes will be disconnected and the patient will be okay, will be responsive. That's why it's so important. In the case of asystole, it's different to this. In this, you are sure that the electrodes are connected, even without checking the electrodes. But in this case, when it is a flat line, can be two different situations and totally opposed with different intervention. Could be a real, true asystole, or could be a fake, okay, fictitious asystole, because when one electrode falls, then in the monitor you see a flat line, but the patient is okay. There is one alternative that has been tested in Nclex in this scenario. You can be sitting, please try to visualize yourself sitting in front of several monitors in a telemetry unit that are monitoring several patients in their rooms, yes? And one of the monitors presents this flat line suddenly. What can you do without going to the client to know if it is an electrode that disconnected or if it is a real asystole? You need to know, I need to draw. You need to know that a person that is having a cardiac monitorization have usually 5 electrodes placed in the chest. Each one of those electrodes have, okay, a cable, okay, that go to whatever is emitting the signal, yes? And you can make different derivations, okay, with those 5 electrodes using different combination. For example, you can do D1, D2, and D3. These are different derivation, and you can do a precordial, okay? You can be doing, for example, B1, B2, B3, B3, or B1, B1, yes? Those 1, 2, 3, 4 derivation. For example, D1 is using this, and this, but it's not using the others. D1, 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 D2. D2 is using this and this, but it's not using the rest. You understand? If one cable, okay, falls, one cable falls, suppose that is this cable, then you can change the button because you are in front of a monitor and you have a flat line, but you have a button here that can make you choose to D1, D2, D3, cable who fell. If in all those derivations you can quickly, okay, evaluate moving the button, all the derivations have flat line, you say, oh, it is a real AC today. Did you understand me?
Yeah, Professor.
Okay, so this is in the English. How you can do to differentiate a real asystole from a fake asystole because a cable fell without leaving the monitor, very quickly without leaving the monitor. The charge nurse is making assignment for clients on a cardiac unit. Which client with a cardiac dysrhythmia should be the charge nurse assigned to the unexperienced new graduate nurse? 44-year-old with ventricular tachycardia, 65 with ventricular fibrillation, 75 with atrial fibrillation, 50 years on chest pain and palpitation. Which one is the easiest and the least complicated?
Atrial fibrillation.
The atrial fibrillation. C as in cat, the atrial fibrillation. Okay, let me move to other topics. A 23-year-old man is admitted with a subdural hematoma and cerebral edema. Sorry, after a motor vehicle accident, a motorcycle accident. Which of the following early symptoms should the nurse expect to see initially? It's redundant, but it's just to make you that it's early.
D as in David.
Okay, D as in David means, okay, here I cannot use, okay. D as in David, let me explain you something, guys. Okay, D as in David, where is it? So, sorry. Means that you need to understand your brain. It's very important that you understand your brain. You have a very complicated brain that has lobules and hemispheres, but then you have a brain stem. This brain stem, okay, this brain stem is very delicate because it's keeping you alive. Here you have centers to have the heart beating, center to control the blood pressure, and a central to make you breathe. You know, even you should know that if you receive an overdose of morphine, you can stop this center, the one that used to breathe, and then you die. You should know that. Okay. Also, you should know that a part of the centers in the brainstem, you have a series of nuclei or group of neurons that produce or originate something called cranial nerve. And then you have neurons for the optic nerve, for the olfactory nerve, for the oculomotor nerve, for the, so 1, 2, 3, 4, until 12. You know that, no? Those nuclei are here in the brain stem, and those nerves are living through little holes that are in the skull and go to your face, to your eyes, to your face. Specifically, you have here the third, 1, 2, 3, third cranial nerve, the oculomotor. This nerve, the oculomotor, the 3, okay, that is here in the brainstem as all the other cranial nerves, control the pupils of a person, okay? So a person should have the pupils perla. A normal person should have the pupils perla. Pupils equal. Need to be the same in both sides. Round. Okay? Pupils equal. Round. Reactive to light and accommodation. So when you have the pupil, and you illuminate the pupil should contract. Okay? It means that this level of your brain, the brain strength, is okay, is okay. You understand? If you have a client that is already having this asymmetry and lack of reaction of the pupil to the light, this patient has already gone, you know what significa gone with the wind, yes? Gone all this part of the brain. And now is affecting the brain stem. Do you understand? So can you understand in your brain that if your brain stem, this part of your brain is compromised, you are done. You need to write your will. You need to call the funeral homes probably. But still you could be, safe. You could be reverted. Okay? So now think a little for the person that said that the pupil is an early manifestation of increased intracranial pressure. Think a little now the next time that you see a patient that has a head trauma and you see that the pupils are affected, okay? That the pupils are affected, yes? So don't say that unequal, undilated pupils is an early, initial manifestation of a patient with a brain edema because it's too late. Precisely one of the ways. Yes, of course. Of course that is A. Of course that is A. Of course that is A. But one person committed a mistake that many of my students also committed. And even if I explain that, because I always explain that when I explain the assessment of the central nervous system, I'm surprised that still there are people don't understand that the pupils, when they don't respond, it's because you are gone, you are done. It is grave, it is serious, it is terminal, it's something to wrong, it's something very serious. The same as having seizure or the decerebration, what means that the brain, the cerebrum is gone. Yeah? So obviously an early manifestation is early. Early means that it's initial, it's not advanced. It's that you are like confused. You are, what day today? What happened to me? Why you are touching me? Who are you? Okay, why I'm here? What is this? I need to go home. You understand? Can you visualize that? Can you imagine this scenario? Can you understand what I'm speaking? Because I'm so concerned, I'm so frustrated. I'm so frustrated that people don't understand when I speak. Because they say the problem is me, because the problem is me. People don't understand. When I say what happened, do you know what I'm doing? I'm faking a confused client. I need to go home. I'm hospitalized, and then I need to go home. And you are my nurse. No, you cannot go home. Who are you? Why you are touching me? What I'm doing? I'm confused. I'm disoriented. Yes. And what happened that I make a contraction of my upper extremities in extension on the feet, and I unresponsive. This cerebrate posturing. Is this early? No. What means that I have seizure, renal seizure? It is early? No, it is not. What means that my pupils dilate? Okay, probably I'm dead. This is one of the criteria we use to see the patient is dead. No heart rate, and then the pupils dilate. Okay, so you need to learn this basic. It is basic. It is basic. You cannot go to the Nclex having this question wrong. Okay, it's not rocket science, guys. It's basic. It's not difficult. It's basic. It's elementary. Okay, it's like elementary school. It's not rocket science. You understand, Naomi? Okay, that's it. Weakness and sorry. A male client is admitted with Guillain-Barre syndrome and complains. You know what is Guillain-Barre, no? You should know that it's a paralysis that starts in the feet and ascends up until creating a serious problem because the respiratory muscle become very weak, and then the patient cannot do what you take for granted. That is, you suck air and blow air. You yes, you suck air and blow out air. You need to understand that in your brain. But to do that, you need to use muscles. And the patient with Guillain-Barre has a condition that, prevent the client, when the Guillain-Barre is advanced, of sucking and blowing air. Yeah, you need to understand that it is the complication, the web Guillain-Barre is something serious. And you have a patient that has weakness and numbness in both hands. So it's high, the paralysis is high, and is anxious. Remember when somebody is anxious, okay? Maybe are the bills. Maybe has a test tomorrow. Maybe he has an Nclex soon. But when a person cannot breathe, the person forgets the bills and forgets the test, the Nclex, and has as a priority, because it's a priority, the lack of air, the lack of oxygen, and makes people very anxious. I don't know if you ever seen a person that is short of breath, but one day you are going to be a nurse, and then you'll see a lot of people that have problems to breathe, and you see how anxious, how desperate, how desesperado they become. So you need to understand that. This is basic, it's elementary school. What will be the priority nursing action in this situation?
Raise the head of the bed and encourage deep breathing cause.
How the hell can you breathe if your muscles are paralyzed?
They can't.
How the heck can you breathe? No, I'm correcting the first statement. If you didn't understand my explanation that the Guillain-Barre is a condition in which the muscle becomes so weak that you cannot suck and blow air, how you can ask as a nurse the client to breathe in and breathe out, to do deep breath? Explain me that. So you need to think better. You need to try to think better and think a little about the disease. So it's ironic, it's sarcastic, it's a sarcasm that you ask a person that cannot breathe because the muscles are paralyzed to do deep breath and cough. It's like a bad joke, okay? Because this is the kind of critical thinking that you need to develop to demonstrate the Nclex that you are logical and safe for a client with Guillain-Barre. And if you don't show that, they cannot give you the license. You understand? So you need to think a little more, especially after that somebody explained to you. And of course, I didn't show pictures of the patient intubated in ICU with a ventilator, but you need to be able to understand that if the person is paralyzed, you cannot ask the person to walk. If the patient has the respirations, okay, the respiratory muscle paralyzed, you cannot ask the patient to take a deep breath and cough. The fact that you are conditioned, that you raise the head of the bed, in this case is not enough, because you can raise the head of the bed and the patient is going to die the same. Because the problem here is not that the patient needs elevation of the head of the bed to have an easier ventilation. The problem here is the patient is paralyzed. Understand? And then there is a method to evaluate objectively, and you should know that if a person is moving too little air in and out, which is the peak flow meter, is a method that you will use in the hospital to measure the volume of air that the patient is sucking and blowing, you know? And it's something that will tell the nurse and the doctors which exact amount of air is the patient sucking and blowing, and is going to determine if the patient cannot move air by him or herself and needs intubation, okay, and connection to a ventilator, because this is the treatment of the Guillain-Barre. So I hope that after this question and explanation of what is Guillain-Barre, and you finally understand that the problem with Guillain-Barre is that the patient paralyzes the muscles of the respiration and needs a machine breathing for them until they recover of this condition. Are we good? So obviously the right answer is assess the peak flow respiratory volume and have endotracheal tube intubation equipment ready. Do an assessment, okay, of how the person is breathing, yes, and of course have ready to call the people that are going to initiate artificial ventilation with what the patient needs, and you need to have ready what those people will need to initiate ventilation, that is an endotracheal tube to intubate the patient and laryngoscope. You understand now the question? So this is an Nclex level question in which you need to demonstrate that you know what is Guillain-Barre, and you need to understand which one is the priority in Guillain-Barre. And you demonstrate that you cannot demand a person that is paralyzed, which is with paraplegia, to walk, the same way that you cannot demand a person that has the respiratory muscle paralyzed to take deep breath and cough, because it's not possible. Make sense? Okay. The use of IV immunoglobulins and plasmapheresis is something that takes time, is a long term, and the priority here, when you see a person that is having the possibility of having problems of low ventilation, oxygenation, the priority is ABCs, okay? The A and the B, the airway and the breathing. This is the priority. But you cannot force the clients to take deep breath and cough because it's paralyzed. Okay. So learn your critical thinking. Use your common sense. Okay, this is also possibly Nclex type question. You're caring for Mr. Lewis, a 67-year-old client with liver cirrhosis. Okay, so you need to know what is cirrhosis. Who developed ascites? You need to know what is ascites, and you need to know what is paracentesis. This is frequently tested in Nclex. Ascites, paracentesis, and cirrhosis are frequently tested in Nclex. You need to know what is the role of the nurse before and after the paracentesis. Okay, you need to know that the nurse must wait and measure the abdominal girth before the paracentesis, the nurse should take the client to the bathroom to pee, to empty the bladder, because it's important that the bladder being emptied before the paracentesis. All those are tested. Sorry. And you need to place the client in the examination table, but knowing that if the client is having paracentesis, the patient have a very intense, big abdomen belly, and here the patient will not tolerate the flat position. You need to place the client with elevation of the head of the bed, because this is going to help the client to breathe better, because now the pressure of the liquid is going to be displaced down. Yeah. And then the questions say, why the paracentesis is done? What is going to improve with the paracentesis? So relief of which symptom or sign indicated the paracentesis.
Dyspnea.
Yes, absolutely. The reason of the paracentesis is to improve the respiration. Any woman that has been pregnant shouldn't understand that. Because at the end of the pregnancy, women notice how difficult it is to breathe, okay, when the abdomen is wet, but it's a physiological condition. Now imagine that you have a much, much bigger, okay, abdomen, and you are severely ill, okay? So the mechanical pushing of the diaphragm that makes the important ascites is what justify a paracentesis. The paracentesis, the only purpose is palliative. I always say it's compassion, because the patient cannot breathe, because the pressure of the ascites over the diaphragm, over the chest. And the paracentesis is to make the patient breathe better. Don't think that the paracentesis benefits the client apart of this detail. By the contrary, paracentesis implies the extraction of a fluid, which is part of the fluid balance of this pathological client, and will produce a fluid volume deficit, in which hypotension after the paracentesis is important and is one of the most common cares or precaution that the nurse needs to take, that the patient will develop hypotension with all the implications. And the paracentesis can deteriorate. It means deteriorate means make worse the cirrhosis. And even the clients can become more jaundiced and more confused. The paracentesis can precipitate, okay, a hepatic encephalopathy. Yeah. And for that reason, you need to have very clear that the indication of the paracentesis is improvement of the dyspnea. Okay, this is a good question. Okay, this question is not helping you. It's too easy. Okay, this is a classical. This is Nclex style. On the second day after admission, a client with fractured femur developed chest pain, tachypnea, and tachycardia. With additional findings, should the nurse identify that is most likely related to a fat embolism?
Sí.
Sí.
The developing of petechiae. Okay, so multiple purple pinpoints dot on the skin, which is the same as petechiae, okay, is what confirms that the patient has a fat embolism. Very good. It is too sencillo. Okay. This is a question about something so elemental. It's first elementary school, is pre-kinder for Nclex. If you know what is Cushing triad. A client has a craniotomy 24 hours ago. The nurse will be most concerned if which of the following symptoms occur. What of the following is the most concerning in a patient that has possibility of increased intracranial pressure?
D as in dog.
D as in dog. D as in dog. Cushing triad is a late and serious, okay, manifestation of increased intracranial pressure that is characterized by systolic hypertension, bradycardia, and widening or separation of the pulse pressure. Of course, it's going to alter the level of consciousness. Of course, it's going to depress the respiration and can evolve to death. Absolutely. This is elementary school. A patient is admitted to the hospital with diagnosis. The patient is admitted to the hospital with diagnosis of Guillain-Barre syndrome. Another question that I stole from English. During the admission interview, which of the following questions is important for the nurse to ask? Recent travel to another country, history of autoimmune disease like lupus, history of recent immunization, presence of skin fungal infection.
Sí.
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 C as in cat. Okay, it's not common, but a part of upper respiratory infections like flu. Immunizations can produce Guillain-Barre. It is also elementary. By the way,
Gastrointestinal.
yes, diarrhea by Campylobacter jejuni, etc. Okay, but by the way, for Nclex, be aware that the only accepted contraindication, absolute contraindication to receive the flu vaccine is history of Guillain-Barre triggered by the flu vaccine. Of course, the other contraindication for the flu vaccine is being child or adolescent taking aspirin for a disease that requires taking aspirin. I'm going to repeat. Flu vaccine is a vaccine that is not live viral vaccine, is a vaccine without any capacity of infecting nobody. It's not a virus, it's just a genetically engineering antigen that is going to produce immunity, should be given every year since 6 months until death. Flu vaccine, yes. Contraindication, egg allergy, no. Egg allergy is not egg. Allergy is not an contraindication for flu vaccine. Contraindication for flu vaccine, 2 contraindications. One, history of Guillain-Barre triggered by flu or flu vaccine. If the person has this in the past, Guillain-Barre, no flu vaccine. Understand? The other contraindication is a child, or an adolescent, a young, very young person, yes, that is taking aspirin. You cannot receive the flu vaccine if you are taking aspirin because you can develop Ray's syndrome. Yeah, there are some children, adolescents, that could be being treated with aspirin in certain moment because Kawasaki, because rheumatic fever, because rheumatoid arthritis, or whatever reason. Those patients need to postpone the flu vaccine. These both situations are in Nclex. But the egg allergy is not a reason for not receiving the flu vaccine. The nurse, if you don't tolerate being very well that, go to the cdc.gov and we'll find this information there. Okay, esto es demasiado estúpido aunque lo pregunta. Okay. A 60-year-old female has been admitted to the hospital with abdominal pain, anemia, and melena. So it's bleeding, no? She complains of feeling weak and dizzy, especially when she moves. She needs to urinate and move her bowels as soon as possible. She is concerned with her privacy, as usually ladies this age are, and is requesting help to go to the bathroom. The nurse should intervene by. How do you think of this for auction is the best from a nurse?
Sí.
course. Need to be seen. Because all the other options imply the patient will stand up and can fall. And a fall is something that we need to avoid. So this person feeling, okay, having bleeding and feeling weak and dizzy should not be allowed to ambulate because will fall. So you need to say, no, you cannot go to the bathroom. I give you privacy, close the curtain, but you need to do that on bed because you cannot get up. So the bedpan is the best option. It is another question stolen from Nclex. Yeah. I had a lot of problem convincing my student that it is the correct answer. They say that no, this is not. Okay, it is an Nclex question. By the way, it is stolen because I personally had this question in my Nclex. The nurse in the emergency department is caring for a patient who experienced a head injury with loss of consciousness. Shortly afterward, the patient regained consciousness for a period of time before experiencing a rapidly declining level of consciousness. The nurse takes quick action, realizing that the patient could have developed
B as in boy.
Okay, you need to review this topic. Okay. You are ¿cómo se llama? Scaring here the people. You're okay, hunting us. Oh, sí. Okay. You need to review what is epidural versus subdural. Let me show you the ¿cómo se llama? The stuff that I teach you. ¿Dónde yo estoy allí? Okay, let me go say, okay, neuro, what is neuro? Also, neuro. Okay, so, okay, here is, this is the slide that I will always show, okay, in class, okay, to differentiate one with the other. You need to pay attention, concentrate, and try to memorize the difference between epidural and subdural hematoma. Epi, the dura is the meninges. Epi means above the meninges. Hematoma is a collection of blood. It's a tumor of blood. Subdural means under, below the meninges, and it's the same. But the epidural, in the slide I always present, okay, usually present in my class, to make your brain remember the difference, is representing red, while the subdural is representing blue. And everybody accepts that red blood is arterial origin, while blue blood is venous origins. I always ask in class, which kind of bleeding you prefer, arterial or venous? Everybody says venous, because everybody knows that the venous bleeding is less severe than an arterial bleeding. Why arterial bleeding is more severe in any part of the body? Because the blood inside the arteries is under high pressure, and then the string, the amount of blood that is spilled is much bigger than in the venous bleeding. So you need to understand that if the epidural hematoma is an arterial bleeding, is worse than the subdural hematoma. And then you don't start to say B or C, B or C. You need to understand that the risky one is the epidural, because it's an artery, the middle meningeal artery that is severed, and there is a violent growth of a hematoma above the meninges that is like a tumor that grows in minutes and is going to produce a severe increment of intracranial pressure. but it produces a classical sequence of events that must be memorized. That is, in the moment of the trauma, in the moments of the hit, the person must lose consciousness. The person must pass out. The person must be knocked out. But the person recovers consciousness after a number of minutes and is having a period of time of some minutes, 7 hours, 20 minutes, whatever. It's not important. In which the patient is lucid, the patient is conscious. But then, because the hematoma is expanding, is growing, and the intracranial pressure is advancing, is progressing, because the blood continues building up, the person rapidly deteriorate. So the level of consciousness starts decreasing, appears, okay, late manifestation, and then the patient falls again in unconsciousness. It is an emergency. It is a neurosurgical emergency. A surgery must be done immediately. Otherwise, the patient will die. Point apart. Subdural hematoma are very frequent in old people. They have minimum trauma and then little veins called bridge veins that go from the brain to the meninges could be, okay, broken. And then there is a less acute, less violent, less intense accumulation of blood usually. Even it's not rare that the diagnosis is made the next day or many days later when the hematoma is produced. Okay? Any rule has exception, but for the test, for the Nclex, we go by the rule, not by the exceptions. So this is the classical presentation of the subdural is less emergency. And many of the subdural hematomas are not evacuated, are left there to be reabsorbed spontaneously. Paying attention, and this, I personally consider that the way that I explain that is magistral, is something that any person that pay attention to the explanation would never have problem to understand that. Once you understand this, once you understand this, sorry, oh Lord. Okay. Once you understand this, you see the sequence. Experience a head injury with loss of consciousness. Shortly afterward, the patient regained consciousness for a period of time before experiencing a rapidly declining of level of consciousness. The nurse take quick action. Why quick action? Because I just explained it's an emergency. Realizing that the patient could have what? Epidural. Okay. So I hope that any person that is paying attention to my explanation this time, if you already had that from me, or if the first time that somebody explained that to you, never forget that. Nurses are responsible in the United States of diagnosing the emergencies and telling the doctor, the rapid responding, whoever, hey, this is going first. And it's tested in English. This is tested in English. This is a question that was in English. It was in English. I reproduced the question. It wasn't, probably it's not exactly, but I reproduced the question. You have this patient and you ask the patient to look to his left. You need to know that the right is not your right, it's the right of the client. This is the right of the client and this is the left. So you ask the client to look to the left, to look in this direction. But then you notice an strabism occur because one eye, obviously, this eye, the left eye, fails in looking at the left. And they ask, which cranial nerve could be failing in the left eye to do the movement?
Six.
Six.
Correct. Is
The
the
six.
the abducens. What mean abducen? Moving out. Movement outward. Yes. So this is a failing to move outward. Yes, the abduction of this eyeball, the abducens, is failing. There is failure of moving this to here. Yes. So and the nerve and the muscle that participates in the abduction, 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 B as in boy, abduction, abierto, abduction of the eye is 6. It is the left abductor nerve, which is the number 6, the one that is failing in this client. So if you select 6, you're okay. If you select the oculomotor com, it's no good. It's no good. Okay? So you need to play with the scenario. Okay? You need to play with the scenario. Okay? So review your cranial nerve. Cranial nerve, as I said in my classes, are high yield, frequently tested in Nclex. It is another, people have been in my class need to remember this question because what's another question? All those questions are reproduction of Nclex. I'm trying to help you for the Nclex. You don't believe me, I know you don't believe me, but I'm trying always to help you for the Nclex. Okay, and you should remember this question because, because the Jaimito. And some of you were my students and probably had this question. Jaimito fell from a mango tree and hit his head. After 8 hours of observations in the ER and a normal CT scan, the physician concluded that the diagnosis of concussion and decided to send him home. Concussion is a benign head trauma. That's why he's sent home. After observation, CT scan that rule out any serious condition. What recommendation should the nurse give Jaimito's parents to prevent complication of this trauma?
D.
D as in dog.
Elevator the head.
D.
Exactly. This is the only recommendation that you need to have. Okay, keep the head elevated so the mild edema that produces the concussion, okay, is going to be drained initially. There is no need of prohibiting Jaimito sleep. You can wake Jaimito up every 2 hours to see how he's in, but you allow Jaimito to sleep. You cannot prevent, you cannot deprivate from sleeping any person that has head trauma. You can awake, despiértate, awake the client every hour, every 2 hours to see how he is. The problem with that, but you don't prohibit the person to sleep. Notice the difference. So when you have a person, when you have a patient in the hospital, okay, and the patient had a head trauma, and doctors order neuro check and neurological exam every 2 hours, you allow the patient to sleep. But then every 2 hours, you, hey, let me check your pupil, let me check your blood pressure, let me check how you're feeling. How is the head? No, it is, okay, you can go to sleep, you are okay, no changes. There is no need of keep the patient MPO, etc., etc. It is too easy. Remember that in about knee amputation, the patient should be allowed to, should be placed in prone position to prevent, okay, contraction of the stump. Endoscopy retrograde cholangiopancreatography. If you don't know what is this, please study this. It is frequent test in Nclex. It's a common test practice nowadays, and nurses need to know what it is and how to care for the client and the complication that could have. You need to know that the, let me go to my, you need to know that the biliary and pancreatic system is complicated. You need to know that you have a tube that has the gallbladder, okay, that come from the liver and join the pancreatic duct, and these two ducts open in a bigger, okay, tube, which is a duodenum, the first part of the small intestine. Yes. And of course, here's the pancreas, here's the liver, okay, and the bile is flowing here in this direction, and the pancreatic juice is flowing here in this direction, and both are going to be spilled and mixed with the food when the person eats and arrive here. Yes. Sometimes there are problems here. Could be a gallstone obstructing here, could be a tumor in the pancreas cancer, etc., etc., etc. So doctors will introduce an endoscope. Endoscope is something that enters through the mouth, goes through the throat, down the esophagus, down the stomach, down the duodenum. So the endoscope is going to arrive until here. To do an endoscopy, the patient needs to be MPO for 8 hours or more. Yes, 8 hours or more. The patient needs to have the throat with local anesthesia to inhibit the gag reflex. Must have inhibited the gag reflex to do endoscopy. And the person usually have sedation, conscious sedation. It's uncomfortable. So they could be using midazolam, could be using propofol, could be using opioids, etc. So MPO, anesthesia in the throat, sedation, and then introduce the endoscope. Then the endoscope is going to produce a catheter. And the catheter will inject iodine backward, o sea, retrograde. So the iodine is going to be injected this way. So we'll be filling all the cavities, all the tubes, okay, this way. Yeah, and they make an X-ray and they see what is happening. And even if there is, for example, a gallstone here, let me change the color gallstone. Let me say the gallstone yellow. Okay, a gallstone here, they can remove the gallstone with the procedure. And for example, if there is a tumor that is compressing, okay, here, okay, the duct, they can introduce an stent, okay, to open a tube stent to open and allow the flow, okay? So it's a wonderful procedure done many times per day in any hospital, in any doctor's GI doctor practice. And nurses will participate before, during, and after the procedure. Need to know before, are you allergic to iodine? Are you taking metformin? Are you having renal disease that contraindicate the use of iodine? Are you MPO? Are you pregnant because X-ray is going to be used? Did you sign the consent? All this is nursing. All this has been delivered to you in the program. And you need to know that after the procedure, the patient cannot eat or drink until the gag reflex return. You need to know that the patient cannot drive home because was sedated and could be groggy. And you need to know that any invasive procedure could have complications. Complications like bleeding, okay? Or even here, this organ called pancreas, when it's manipulated, can inflame in something called pancreatitis, okay? Pancreatitis. Could be, for example, a perforation. So you can have here a perforation, a hole, because the manipulation, and now, qué sé yo, bile can be spilled in the peritoneum, peritonitis, etc., etc. So after the procedure, you need to observe for a non-expected complication. Unexpected complication. So this is nursing, this is tested in Nclex, this is common sense. You need to know what is the procedure and what to deal with that. I personally feel very well with myself because I explained that very well in my classes. The problem is if you pay attention or you remember that, okay? Very well. So now you have this question that is also a reproduction of an Nclex question. I'm surprised with myself how many questions I use that are Nclex questions, that I stole from Nclex. The nurse is caring for a patient that has endoscopic retrograde cholangiopancreatography with papillotomy for a stone removal. I explained that. What assessment finder requires immediate report to the provider. Drowsiness and confusion, absent gag reflex, decreased bowel sounds, abdominal pain radiating to the back.
Sí, abdominal pain.
Of course, the other are expected. The others, doctor, the patient doesn't have gag reflex. Idiot, it is expected. We gave local and the patient is confused and drowsy. Of course, we gave him propofol. Don't allow to drive back home. The bowel sounds are very, very, very scarce. Are present, but very, of course, it's empty stomach. When you have empty stomach, okay, when you have the intestine empty, there are no bowel sounds because, you know, there is no peristalsis. Okay, but the presence of an abdominal pain, which is not expected, especially radiating to the back, that suggests pancreatitis, is so. This question was in English. Está regalada. Okay, but please, English required. Okay, remember that please listen to me. People that go to, let me see, a very good university in Massachusetts, okay, Harvard School of Nursing. Yes, people that go up to the School of Nursing in Harvard, yes, will have the same Nclex that you will have. Can you understand that? I think that I repeat that so many times to my students, and I think they don't understand me. So it doesn't mean that you cannot pass the Nclex. It means that Nclex is a demanding test for any nurse in the union, and you need to be prepared for the Nclex, at least with the basic. And I know that we present to you what you need to know. At least we tell you what you need to know. And you need to study, you need to prepare, you need to practice a lot, okay? Even doctors, physicians that come from other countries, when they prepare for the Nclex, they take 15 days, 3 weeks off and study, 16 hours per day, and then go to take the English, okay? And you need to understand that, working full-time and overtime, etc., is not the ideal, condition to prepare for the English. So you need to plan, because you are going to take the English and you need to go, okay, well prepared, okay, to finally pass the test, and you never again will take this test again. Now this license is yours, and you can go to any state of the union from Alaska to Florida, from California to Las Carolinas, you know? And this is your license. Nobody can take that unless you commit a serious mistake. Yeah. And this license will allow you to advance, to progress to high levels, because you can reach very high levels and make a lot of money. As a nurse, you can make a lot of money. Okay, if you are smart in advancing and you move on. Okay, and you are good, of course, if you are good. But guys, it requires an effort. Okay. Okay, it is even if it is an English question, it wasn't an English question. It was a lady going to a GI upper GI series as a barium swallow. It was a lady that was young, 38 is young, and then they asked if it was allergic to barium and allergic to iodine. You need to check if it is allowed to apply allergic to barium, because they don't use iodine in the barium swallow. And of course, they ask in the question if they have dysphagia, of course, because you need to swallow the barium. And they ask in the question as a nurse if the patient is MPO. And also the last menstrual period, because remember, it's an early woman. Entonces, all those needed to be, tested. There is no need of prophylactic antibiotic to swallow barium, and there is not need of asking for iodine allergy, because it's not iodine, is not going to be used in this test. Okay, this is fundamentals. Guys, Nclex, there is a lot of fundamentals. They are going to ask you if you know how to wash the feet of a client and to put in order the procedure. They are asking you how to apply aquathermia, which is a warm or hot water bag in a swollen part. They will ask you how to make a bed. They will ask you how to administer an enema, how to administer eye drops, how to remove a Foley, how to remove a nasogastric tube, how to change the dressing. Oh Lord, all those fundamentals are in Nclex without exception. How to suction a client, all those procedures. Yes. And they can ask you any nursing pertinent question about all those procedures. This is an example of it. You need to have an idea what means an enema. What is a cleansing enema? Okay? What is a tap water enema? Yes? You need to know that all the details, how many inches you introduce the cannula in the rectum. You need to know how much you should elevate the bag that has the water to make it enter inside the colon of the patient. You need to know the position of the patient. And you need to know this detail. You are making the water pass and the patient feels pain. It is a possibility. Cramps, intestinal cramps, is something that all we know what it is, because any one of us had in the past a diarrhea. And then you know what is dolores de barriga, intestinal cramps. So while passing the enema, the patient could complain of intestinal cramps. Why? Because there is the liquid is entering and is distending the walls of the colon, and it can initiate a strong peristaltic contraction, and those intense peristaltic contractions can produce intestinal cramps. And then they ask you, what you do? But you ay, me duele, ay, que dolor de barriga tengo, I have a lot of abdominal pain. Okay, nurse, I have abdominal pain. Okay, what you do?
Lower the height of the
Of course. What you do is lower the height of the bag, because it's the best option there. making the water pass slower, making less peristalsis, less stimulation, and less abdominal cramp. This is the best answer there. Could be another question, clamp for 2 minutes, clamp the water for 2 minutes until the pain disappears and then reopen again, you know? So we can continue the enema, but of course we're trying to make the enema the least uncomfortable possible. There is no need of this continued procedure because it's something that is expected. We need to know that when we study how to administer enema, that is expected, okay? You don't raise the enema back unless it's your mother-in-law, and you don't continue ignoring the patient complaint. So the best option is lower the height of the tap water enema container. Any person that have study fundamentals and know how to do the procedure need to know that it is the intervention. Crohn's disease is curable, can be cured. The answer is no.
No.
So chronic disease, when you have the you suffer disease the rest of your life. The etiology is autoimmune. And as any chronic disease, you will live with this disease. You will have good moments and bad moments, as happens with any chronic disease. Arthritis, lupus, whatever, chronic disease. Okay, COPD, asthma. Yeah. Periods in which the disease is more intense, periods in the disease is in remission or less intense. Yes. And because it's an autoimmune disease, the treatment is based in anti-inflammatory medications and immune suppressor medication. Yes. Okay, so obviously when you have a question that this is a very common type of question in Nclex because the client is asking the nurse, can you explain me what is this Crohn's disease that the doctor just diagnosed? You say, well, it is a chronic disease, you have inflammation in the colon, and it's the disease that you know that, that is chronic with periods of remissions and periods of reappearance that will treat it with immune suppressors, okay? Obviously, the other option that say the disease can be cured, that is resolved with a surgery. Remember that there is another inflammatory disease in the colon that is the ulcerative colitis. That is the one that can have the toxic megacolon, okay? And this is the one that could have the, ¿cómo se llama? The colectomy, okay? The colectomy. So don't confuse the two diseases, okay? Don't confuse. Don't confuse. Ok, ¿dónde es que está la 3? No. En la 2, creo que es en la 2. Sí, aquí está. Okay, so remember that there are two diseases that are the ulcerative colitis and the Crohn's disease. Yes. And notice the similarities and the differences. And remember that the one that can make the toxic megacolon is the ulcerative colitis that need to remove the colon. So now the patient is going to be left with an ileostomy, okay? The colectomy is not indicated in Crohn's disease, okay? Don't confuse that, no, don't confuse that, the two diseases, okay? It is a very common disease. It is frequently tested in Nclex. This is not a question from Nclex, but it is frequently tested in Nclex, okay? Okay, how do you recognize that a liquid coming from the nose or the ears of a patient is cerebrospinal fluid?
Glucose test.
If the liquid comes pink, it's because it has blood, and the blood has glucose.
Halo test.
Hello.
So in some occasions is the glucose, and some occasions is the halo test. Yes? Yes or not?
Yes.
Okay. In which situation is glucose?
When it's clear.
When it's clear, when has no blood. And in which occasion is the halo test? When it is with blood. Yes. Okay. It is very simple. Okay. It's very simple. That's why I always show two people, okay, having the leak. Okay, having the leak. That is the person that have just a second. Okay, creo que es el neuro 3. The person that has, okay, the clear liquid. Just a second, what is this? Yes. The person that had the clear liquid, okay, the clear liquid, yeah. You see that the liquid is transparent, it's clear, no? And you do the glucose. Or the person that have the liquid combined with blood, then you need the halo test, yes? Okay, so don't confuse that, because you know my students confuse that a lot, and lo que tienen que aprendérselo. You need to learn that. Yeah. Okay. Because this is Nclex question. Okay, this is okay. I'm trying to find the Nclex question that I had in this test. Okay, this is an Nclex question. Okay, what happens when the bile normally mixes with the food that you eat? This bile gives your poo-poo the brown color. Yeah. So what could happen if the bile cannot live because there is an obstruction of this common biliary duct? Your poo-poo becomes what? White, because clay color, yes? But then what is doing the bile? Need to go someplace. And then the bile's backflow, you know, go back. And then the person develop in the eyes. What happened in the eyes? Become yellow, yes? They have jaundice. And then the bile need to live someplace. And the only place that can find to live is the urine. So the urine becomes brown, yes? Becomes dark, becomes a tea color, black tea color, or Coke color, yes? Okay, so it's something that you need to know. So if a patient who has gallstones and obstructive jaundice and has a surgery, and the bile is still is meaning that todavía, still, the bile is still obstructed from entering the bowel. How do you know that? What is four stuff you expect to see? Diaz in diamond, dark tea color urine. Yeah. No brown stools. Okay. Okay. Brown stool means that is okay. Yeah. Okay, another question that is common in English. Cellular apply risk factor for colon cancer. Okay. What are polyps? You know the polyps, family history, and history of ulcerative colitis or Crohn's disease. Okay, those three diseases, those three conditions, sorry. Family history, history of polyps, and history of inflammatory bowel disease. Those are the three risk factors. For cancer, please study the cancer that I explained to you, the risk factor for the cancers, okay? Because it is a common question. Okay. Remember, you have a client that will have an X-ray swallowing barium. This barium swallow will interfere with all other tests. So it's the one that must be left at last. So do all the other, the ultrasound, endoscopy, whatever, and the last is going to be the barium swallow because interfere with all the others. It's another topic that has been tested in Nclex. Okay, the nurse is administering mannitol to a client who had a craniotomy and is complicated with brain edema and increased intracranial pressure. So you need to know that mannitol is an osmotic diuretic used for the treatment of brain edema and increased intracranial pressure. What nursing observation would indicate that the medication is producing the desired effect?
B. The systolic pressure has decreased.
A.
There is no desired. There is no
It's D.
desired. There is no desired of reducing blood pressure. There is no desire of reducing diastolic blood pressure when we give mannitol. The diastolic blood pressure is not modified by brain edema. Okay? And there is the desire, the attempt of giving money. I'm correcting the wrong answer. So the person will correct that. And if they have a similar question, his Nclex is successful. All my intention is to make you successful, to get drunk the day or the day following the test. This is my purpose, because you are celebrating, not because you are depressed. This is the only reason for the one I make all this effort. Okay, so don't misunderstand me, because ese otro problema. You are the crystal generation. You become upset so easily. You are delicate. Okay. So the purpose of giving mannitol is not to decrease the blood pressure. Yeah. The purpose of giving the mannitol is to eliminate or reduce the increased intracranial pressure. So take care when you have this question of not overthinking y buscándole la quinta pata al gato o la contrapelusa de la pelusa. Sorry for the Spanish, because I know that most of the people that are hearing and understanding me. Okay, so don't overthink. Don't find that it's not needed. Don't look for what is not needed. Okay, so why we give mannitol in a patient with brain edema and increase the intracranial pressure? To reduce the intracranial pressure. The assessment shows reduction of the intracranial pressure. It's like something like this. What color is the white horse of Napoleon? You know that? So don't overthink. Don't look for the fifth leg in the cat. This is not a leg. Yes? So it's the tail. Okay? So that's it. You understand? So Nclex is straightforward. You will support me when you take your Nclex. Maybe the topics have never been heard by you because you never studied that. Because what is complicated is nursing. Nursing in America is almost equivalent to medical school in the Caribbean and South America. And usually we go to medical school 7 years, 6.5 years in my case, okay? And you did that in 1 year and 1 semester, in 4 semesters. So it's a very extensive, okay, content nursing, okay? Because you did an accelerated program. Well, I'm talking for in my program. My program is associate, and I assuming that of course some of you are bachelor, okay, but the same, they're doing the same. Okay, so understand that Nclex has a lot of content, but the question is straightforward. So don't overthink. No le busquen la quinta pata al gato. Don't complicate. So you see how easy is this question. So there is no reason to commit mistake in this question. So please dedicate time to read carefully. Don't rush in your Nclex, and don't overthink. Don't overthink. There is no bad intention in Nclex. They're just the intention exploring, one, your knowledge, and second, your common sense. It's important that when you go to your Nclex, don't go too anxious. Guys, it's just a test. It's just a test. That's it. Life is more demanding than just a test. Okay? Okay. The nurse is caring for a client. I already corrected some of you in your knowledge deficit of the meaning of having an altered pupil reaction. So I hope that you can answer this question correctly. The nurse is caring for clients in the neurology unit. What would be the most appropriate action for the nurse to take after noting that a client suddenly developed a fixed and dilated pupil? What do you do?
Contact the healthcare provider.
Of course, it's an emergency. It's an emergency. Don't commit the mistake of doing more assessment, because you don't need more assessment. If the client develop a new onset, sudden, fixed and dilated pupil, it's because there is a brain herniation compressing the third cranial nerve, and it's an emergency. It's an emergency. So if you start doing, for example, a complete neurological assessment, Señor, ¿qué día es hoy? What day is today? Okay, who's the president? Okay, raise your right hand. Now raise your left hand. Now let me check your reflexes. Let me check your cranial nerve. Okay, the patient will die. Apart that is not going to collaborate, because if the patient is having this pupil, probably is in a very severe deterioration of the level of consciousness. So please, again, I insist, actually, understand what means when the pupils are affected. That's why you need to have this lamp, how you call the flashlight, yes? And you need to check the pupils as a part of the assessment of patients. That even you see that in movies, in TV, you know? Okay, good. Okay. Ulcers can be in the stomach or the duodenum. What has in special the ulcers in the stomach, not in the duodenum, that you need to know?
Sí. Can be developed malignancy.
Yes. The ulcers in the stomach can become cancer, while the ulcers in the duodenum never become cancer. Both can bleed. Both can perforate, producing peritonitis. And both can produce pain. But only the ulcer in the stomach can become cancer. That's why it's important to always have a biopsy. It's interesting that the pain, if the ulcer is in the stomach, in the back where the food falls, immediately you eat. So when you eat, the presence of the food stimulates the secretion of acid, and then you have a hole, an ulcer in the stomach. So immediately that you eat, immediately means right now, you know? You eat and right now, immediately. What means immediately? Immediately you eat, the acid is spilled over the hole, over the wound, over the ulcer. And of course, it's going to hurt immediately. And the patient will associate eating with pain. What happens if you associate eating with pain? You don't eat. And then that's why classically those clients, ¿cómo se llama? Lose weight. The duodenum is beyond the stomach and is separated by a valve or sphincter called pyloric valve, pyloric sphincter. So when you eat, the food isn't going to the duodenum until a while later, usually 2, 3, even 4 hours. So if the wound is in the duodenum, The acid won't arrive to the duodenum until 3-4 hours after eating. So for that reason, the pain in the duodenal ulcer is delayed. Okay, so that's why the pain awakened the clients in the night, because they had supper at 7, 8 p.m. and then the night is when this food arrived to the duodenum. Okay, and that's it. It is a reproduction of an English question. You have a patient who has a surgery of the hip, total hip replacement. Yes. And now has pain, and you see that the side of the surgery, the right foot, which was the side of the surgery, looks shorter and pointing outward. So what means that? It means that there is a luxation. The artificial head of the femur pop out the socket, the artificial acetabulum that in this surgery is created. This is a complication, generally consequence of bad nursing care after this surgery, because nurses are responsible of preventing or avoiding clients that had this hip replacement surgery, are responsible of keeping the legs always open, separated, abducted, okay? Having an abductor pillow always between the legs. And preventing the patient from flexion the hip, like when sitting, less than 90 degrees. So could not be sitting in a low chair, in a low toilet, could not be bending over to pull up socks or to tie shoelaces, you know? Those positions make the client flex the hip less than 90 degrees. We can produce this luxation. So the question was more or less like this. That's why I reproduced the question. And what you need to do is to recognize when the extremity is shorter and rotate externally, is because this client has dislocation of the prosthesis, and you need to immediately call the provider. Everybody understood the questions and my explanation, yes? Because it's another topic that is frequent in Nclex, the hip replacement.
Yes.
So common. There are so many,
Yes,
so many. You see so many times hip replacement, so many clients. Do you know that the lactulose for hepatic encephalopathy to reduce the ammonia can be given also in enema? More than that, when the patient has severe altered mental status, it's more commonly given in enema because it's faster and safer. Okay, so don't be surprised when you study the pharmacology of the lactulose. You need to know from pharmacology it can be given orally or in rectal enema. Lactulose is the treatment of the hepatic encephalopathy. You need to remember that the liver, your liver, eliminates a toxin, a poison that you produce in your metabolism, the metabolism of the proteins, yes? And when you degrade your proteins, you produce ammonia. Ammonia is something that smells very strong, that can even be bought in Publix to clean the toilet, and can be used to resuscitate people that pass out. When somebody pass out, you can use ammonia capsule because it's very intense, the smell, very irritant. Okay, and imagine having this stuff in your blood that is so strong. The liver, our good livers, so take care of your livers. Don't drink too much. Don't celebrate too much when you pass the ink. The liver eliminates this ammonia from the blood. How eliminate this ammonia? Transform the ammonia in something that is less toxic, that is the urea. And the kidneys eliminate the urea in the urine, you know? But liver transform the ammonia in urea, okay? But when the liver is severely damaged, like in hepatic cirrhosis, you don't see that in hepatitis, you don't see that in other diseases of the liver. It's only in hepatic cirrhosis, yes? Or fulminant, okay, diseases of the liver, necrosis, hepatic necrosis, like the Rey syndrome, you know, the one that the aspirin, no, with fever, yes, okay. When the, ¿cómo se llama? When the liver has cirrhosis, then cannot eliminate the ammonia. The ammonia builds up and goes to the brain and produces damage in the brain. And it's called hepatic encephalopathy. That produces a tremor, a shaking in the hands called asterixis. Yes, okay. And the treatment of this is lactulose that can be given orally or in enema. This is pharmacology, yeah? And the lactulose is going to have a side effect or adverse effect are going to produce, okay, diarrhea. So the amount of lactulose cannot be too much. Just the necessary to make the patient poo-poo 3 times per day. And the poo-poo should not be liquid. Should be soft or loose, but not liquid. Yeah. So some people require a little more, some people a little less. So need to be individualized the dose until reaching the 3 bowel movement per day, 2 to 3 bowel movement per day of loose stools. Because diarrhea is not desired. A profuse diarrhea is not desired because can dehydrate the patient and making the patient worse. Make sense? But yes, remember the lactulose is given, but can be given in enema. People surprised, they didn't just study pharmacology, it's given orally in enema. It's like the K-exhalate, not K-exhalate, sodium polyethylene. For what is sodium polyethylene? For hypercalemia. Okay? For what is sodium polyethylene? For hypercalemia. But can be given orally or in enema. Which one is more effective? Enema. Okay? So you need to know that. Okay, it are called retention enema because there are 2 types of enema. It is in the Nclex. There is one enema which is called cleansing, to clean, or tap water enema, or salt enemas. That are enemas that you introduce the enema and the patient needs to go running to the bathroom to empty the intestine. There is no need of holding. Well, the best is to hold like 1 minute, 2 minutes. Okay, how much as tolerate to make it very, very effective in cleansing. And then you go running to the toilet or to the bedpan. Yeah. But there is other type of enema like lactulose and ¿cómo se llama el otro? Sodium polyethylene. That is retention. So when the enema is introduced, of course, there are lower volumes, smaller volumes, yes? When the enema is introduced, the patient need to hold, need to close the sphincter, need to close the anus and hold because you want the medication to stay in the colon for several hours doing its stuff, its work, yeah? So please know that because you are supposed to know that. You are supposed to know that. What is this? Okay, it is stupid. Okay, you know that rebound tenderness is peritonitis. Is something very bad. Yes. So somebody that you know that has abdominal pain and has rebound tenderness is the priority. Need to be reported. Everybody knows that. Everybody except my student. Okay. When you have a question that talks about surgery of the stomach, immediately, automatically think in dumping syndrome. So this is the way that Nclex can test you if you correlate the dumping syndrome with the cause of the dumping syndrome, which is gastric surgery. Yeah, because it's the gastric surgery, the modification that surgeons can do in the stomach, what can produce the dumping syndrome. You understand? And now you know the two most important aspects of the dumping syndrome is one, is eat a small amount. It is probably the most important. Eat small amount of food, but more frequently. Okay, so instead of 3 meals, have 6 or 8 meals per day, which is the right answer of this question. The second important is lay down, go horizontal after eating for a while. Rest horizontal, lay down, okay? When you eat for a while. All the opposite as in GERD, in gastroesophageal reflux disease. Like, for example, a pregnant woman. Because should stay upright after eating. This is what the Nclex ask you. So don't tell me that it's complicated. There is a rocket science. Because, you know, it's very, very basic. But you need to know that. And maybe the third to remember of the dumping syndrome is don't let the clients eat sugar. Sugar or sugary food is very bad for them. Enhance or intensifies the symptoms of the dumping syndrome. That's it. This is what you need to know. The water should be drunk between meals, not with the meals, because tembucha. I don't know how to say the English. It's going to make you bloated and worst. Okay, it is it is not from Nclex. It was from one of the, I think, from Hesse. But it is a good question because it's critical thinking. You have a client who drinks alcohol in important amount, and the laboratory translates hepatic malfunction because has elevated AST and bilirubin, and the client is going to surgery. What is the main consequence? The main complication of having liver disease if you go to surgery?
Bleeding.
Bleeding, because precisely the liver is in charge of producing the coagulation factors, you know? And the problem in surgery, the main problem is, the number one problem in surgery is bleeding. Why? Because the doctor is going to take a knife and is going to cut you open, and then you bleed. And if you are, you know, how you expect to be the albumin in cirrhosis, high or low?
Low.
Low.
Because the albumin is produced also by the liver, so it's low. It's low. Okay. The one that elevates is the ammonia, not the BUN. Okay. The BUN elevates in renal disease. Okay. Very good. Okay. Okay. It is time. Sin embargo, phenytoin is frequent in Nclex. Okay. Remember that phenytoin, the normal value is 10 to 20. ¿Qué es lo que han preguntado de phenytoin? Okay, the phenytoin, they have asked you if you know which manifestations are of phenytoin toxicity when it's too high. Remember ataxia and nystagmus. Ataxia or ataxia or ataxia. Ataxia is the way that is correctly pronounced. Ataxia. Okay, ataxia is when you have a loss of coordination of the movement. The best way of understanding ataxia is a drunk person walking. Any time that you have seen a person who is drunk walking and falling and, you know, and having this kind of gait, it is ataxia. Ataxia can be confused with a drunk person. Okay, even speaking, they speak like a drunk person. And sadly, neurological clients has been misclassified or misinterpreted by the police, etc., as a drunk person, as a comment, so you remember what is ataxia. And nystagmus, to explore nystagmus, you need to ask the client to look to one extreme. So look to your right or look to your left, wherever you ask the client to look, and then you see that instead of keeping the side in a fixed position, the eyes start jumping. So it's a jumping. So it's a continue jumping. You know, it's a nystagmus. So those are these have been tested in phenytoin. Yes. Okay, let's see this question. Okay. What you do immediately after a tonic-clonic seizure stops. Okay? What the nurse should do immediately after a tonic-clonic seizure.
A and B.
Sí. Oh, no.
A.
You better introduce your fingers in the mouth of the client, yeah? Better than the tongue applicator. So they amputate your finger and you never forget that you don't introduce anything in the mouth of the clients, yes? So instead of applicators, introduce your fingers, okay? Ni se te ocurra ponerse. God's sake, okay? Sí, okay? And remember that immediately seizure stops is when you turn the client to a lateral position, so all the secretions are going to be expelled, and if there is need of suctioning, the suction can be done. Immediately the patient stops seizing, and accompany the client because the client will wake up very confused. So remember that during the seizure, before the seizure, when the patient has the aura, make the patient sit or sit in the floor, whatever, or lay down, because you don't want the patient falling in the moment of the tonic seizure and the loss of consciousness. During the seizure, when the patient is jerking, is contracting and relaxing, don't restrain the movements because you can produce dislocations and fractures. Yes? Avoid trauma when the patient is moving, is jerking and moving, yes? Avoid trauma. So remove any furniture. If the patient is hitting the head against the floor, put a pillow or your tie or something, yes? And there is a neck tie or a button neck, lose that so the necktie cannot strangulate the client, etc., etc. During the seizure, and observe all the movement. And immediately after the seizure, turn the clients in recovery position, lateral positions, recovery position, and suction the mouth if needed and possible, because there is the moment in which the client can aspirate. Because when the seizure stops is when the patient starts breathing again, and if there is secretions, vomits, or whatever in the mouth, is when can be aspirated. That's why it's important to turn the client and aspirate the client. Okay, remember in pancreatitis, the first that you do is to keep the patient MPO, because you don't want food going to the duodenum to stimulate the production of more pancreatic juice. And because frequently the patient is having intestinal paralysis and abdominal distension, doctors frequently, at least in is a severe pancreatitis in the first hour, order nasogastric suction. Okay, remember that the patient needs IV fluids because he's having hypovolemia, and don't forget the Guillain and Turner, okay, Collins and Turner signs, because it's frequently tested. Don't forget that amylase and lipase are used just once to diagnose pancreatitis. No every day. There is no need of doing that every day. It's like doing HIV test. If the HIV test is done only once, it is positive, you don't need to repeat the HIV test. It's already positive, yes? So the same, if amylase and lipase are elevated, there is no need, there are no indication of follow-up of the values amylase, okay? Only you need to do that once. But what is important is to keep the patient MPO and to anticipate that nasogastric suction is necessary, IV fluids are necessary, and that amylase and lipase elevate in the pancreatitis. Or the question that I seen about pancreatitis. Or another question that is in pancreatitis. The patient with pancreatitis cannot be on bed straight, supine straight, so cannot lay down straight, flat, because the pain is worse. Allow the patient in lateral position with knees against the chest. So a knee chest position and lateral position. It's like the fetal position. What is the fetal position? It's like the fetal position. This is the antalgic position in pancreatitis. It was tested. It is an Nclex question, okay? I did that in my student many times, you know that, but for comfort, you need to know what is comfort and what is life-saving intervention. You need to differentiate which interventions are priorities or life-saving or very important, and which interventions are for comfort, which are also important, but of course less important. So in meningitis, as in many other diseases, they are going to ask you for comfort. I saw this term frequently used in Nclex question. In the case of meningitis, the light is very uncomfortable. So for comfort, you keep the environment dim, the light dim or darkened. For ¿cómo se llama? Migraine, for comfort also, you keep the environment dark and quiet. For example, I think for comfort, what you do with a client with hypothyroidism, and then the answer was give blankets, extra blankets, because they are all time cold. And I also saw that for comfort in hyperthyroidism, what you do is keep the AC very cold because they feel comfortable if the room is cold. So I saw this comfort concept tested frequently to see if you can differentiate, okay, what is comfort and what is priority nursing intervention. You understand what I mean? Okay, remember that melena, the arterial stool, is upper GI bleeding. And in this question, the only upper GI mentioned is the duodenum. Okay, remember in appendicitis, you should not apply warmth in the abdomen. You should not allow the client to eat. You should not give enemas. You should not give laxative. You just can give analgesics ordered by the doctor. There is a misconception that in appendicitis cannot be giving analgesic. If the doctor that is taking care of the client and is going to do surgery doesn't want the patient to be in unnecessary pain, the doctor can order morphine or whatever they want to order, parenteral of course, no oral, to ¿cómo se llama? To calm down the pain, meanwhile the patient is prepared for surgery. Okay? Celiac disease. Celiac disease is in Nclex. And the only question that you will have of celiac disease is the diet. Okay, is the diet. Yes. So remember that the diet should eliminate only four stuff, which is wheat, oat, rye, and barley. You need to learn that. You need to learn that. Even if you have bad memory, if you don't learn the brow acronyms, B for barley, R for rye, O for oat, and W for wheat. So if you have this question, what you answer? Because the mother is doing something wrong. What is doing wrong?
D.
Exacto.
B.
You said D as in diamond, no? D as in
Yes.
okay, absolutely. The oats are contraindicated. Okay, but the others, corn, quinoa, rice, vitamins are not contraindicated. So this is the only topic. It's not. This is the only detail that is tested in Nclex, but frequently about celiac disease. It is another Nclex question. Okay, what causes Parkinson? Why is giving levodopa? Deficiency of what is causing Parkinson? Acetylcholine, serotonin, or dopamine?
C.
Dopamine. The deficiency of dopamine what produces Parkinson disease.
Yeah.
And the treatment is increasing dopamine. Levodopa transformed in dopamine. Also could be used anticholinergic, but is less frequent. Okay. How, pay attention, how antipsychotic medication, especially the old one, the typical, works improving schizophrenia. What is the mechanism of action of haloperidol or chlorpromazine in the improvement of the psychosis in schizophrenia? What is the mechanism of action at a level of neurotransmitters?
Decrease dopamine.
Decrease dopamine. And which one is the side effect that can occur when dopamine is decreased? The Parkinsonism, the extrapyramidal syndrome.
Con-like symptoms.
Exactly. So notice the association because Nclex love this question. Okay. Don't forget that there are some medication for nausea and vomit, like the ondansetron and the metoclopramide and ondansetron that also reduce dopamine and can produce EPS, extrapyramidal syndrome. Okay, don't forget that because also have been in English. Okay, guys, time flies when you're having fun. Ya grité suficiente hoy. Okay, so we see you next Monday. Okay, no questions. Okay, see you on Monday then. Practicing question and screaming so you remember my screen in your English. Bye-bye.
Thank you, Professor.
Thank you, Professor. Good
Thank
night.
you.
Thank you,
Thank you for
Professor. Good
listening.
night.
And
Night.
study a
so
lot,
much.
guys. Remember, this license will change your life and the life of the people around you. Please dedicate 100% of your motivation, energy, and time to take this test and to be successful. Ánimo.
Thank you, Professor.
Gracias, Profesor.
Profesor,
Chao.
usted es el mejor.
No,
Gracias y es un
mejor ni
placer
que mejor.
volver a tomar su clase.
No,
Es
please.
un placer. Usted es el mejor de los mejores. La
No.
verdad.
Chao, chao.
Yo-
Cuídense. Estudien mucho.
Ok.
Gracias.
Thank you.
Thank you.